Diagnosing ADHD in girls. Some experts say their symptoms are often overlooked and underreported. Here to explain, Dr. Ashwini Nadkarni, the Associate Medical Director of Psychiatric Specialties at the Brigham. Thanks for joining us.
Thank you for having me.
Well, so I don't need to tell you, the CDC tracks the rates of attention deficit hyperactivity disorder very closely. So if we look at the breakdown by gender, you see that boys are nearly twice as likely to be diagnosed with ADHD than girls. What do you want parents to know about those numbers?
Yeah, so this is such vital data because what it really demonstrates is that there is a gender gap in the diagnosis of ADHD. Now, ADHD is a common mental health condition in which people experience inattention, hyperactivity, or impulsivity. But what we're seeing is that girls and women tend to be underdiagnosed for a few reasons. First, ADHD can present in more subtle ways in girls. There can be more symptoms of inattention, and those can go missed. Second, girls are more likely to be mislabeled as having a mood disorder because ADHD can very commonly present with mental health conditions like anxiety or depression. And another thing to keep in mind is those societal expectations or cultural norms, which call upon girls to appear more organized or obedient. So as a result, girls may be working harder to mask the symptoms, and all of those can contribute to that underdiagnosis that you see there in those facts.
So what are some of the symptoms that parents and maybe even doctors miss?
So those are those symptoms of inattention. For instance, girls may be more likely to present with forgetfulness, distraction, disorganization, or getting sidetracked. On the other hand, boys may be presenting with those symptoms of hyperactivity or impulsivity.
Is this something that I guess both girls and boys can grow out of, or are there adult women who maybe were never diagnosed and still kind of coping with the condition?
So ADHD is a lifelong mental health condition, meaning it doesn't go away, but treatment can significantly improve symptoms and help people manage the condition. Now, we know that in the US, approximately 6% of adults are living with ADHD. But what we also know is that 60% of women are diagnosed as adults as compared to 40% of men. Now, ADHD is a genetic condition, which means that if you have a family member who has it, you may be more likely to have it. And so if that's the case, it's important to talk to your doctor about whether that inattention you're experiencing may be ADHD. But do keep in mind, it can also be overdiagnosed. So you want to note that a number of other medical conditions or mental health disorders could also be contributing to inattention.
Okay, well, thank you, Dr. Nadkarni, for joining us today.
Thank you for having me.